So I'm going to speak about school advocacy, and first I just want to tell you that as I talk you through this, I'm a parent of a 10-year-old with an eosinophilic GI disease. He also has other medical needs. So we have been through advocating for our son through getting an IHP, getting a 504 plan, and having an IEP 2 different times. So we have gone through this ourselves. We've been in the position of advocating to the point we've hired professional advocates, being advised to have attorneys present, recording all meetings, having representatives from our school district at every meeting, and to the point now that our situation is with the same school district so wonderful that I never want to leave there. So we have worked through every angle, and I know this can be a very emotional thing to advocate for with your child, but I hope that I can encourage you today to understand what your child's rights are and also to be able to advocate in a positive way. So the ABCs of education. Every child in the U.S. has to go to school, and we all understand that our children have the right to a free and public education. I'm also sure that you all understand that children with medical conditions also have this right. Those rights are described as FAPE, the free and appropriate public education. We all assume that every child is entitled to FAPE, but in the history of the United States, children with disabilities did not always get a free and public education and were discriminated against. So laws were put into place to take care of these children and make sure that they got these rights. Now, you say, what does that have to do with my child with an EGID? Actually, children with eosinophilic disorders, by law, can be classified as disabled under this law. According to the law, they are entitled to the rights of a free and appropriate public education because EGIDs affect their eating, which is a major life activity. So how does this change things at school? You can have an IHP, which is an individualized health plan. You can have a 504 plan with accommodations. It helps you with support within the school community and the school environment. And it also can allow for legal recourse if the school is not doing what they need to do to accommodate your child. An individualized health plan. This is a plan that will take care of your child's medical needs at school. It doesn't include accommodations. These are things like if you have an emergency action plan for food allergies, those will be covered under an IHP. My son is tube fed, so all of his tube feeding instructions for the school nurse are included under the IHP. Also, there can be things in there like dispensing medications at school. So these are the sort of things that typically are changed from time to time. They're instructions for the school staff to do X, Y, Z if my child has this type of reaction to a food. But what an IHP is not, it is not something that is going to provide accommodations for your child. So if your child needs accommodations such as unlimited access to the restroom, an IHP is not the place for that. So here are some examples of what can be in an IHP. So the other thing is that an IHP is not legally binding, so you don't really have any recourse if the school nurse, for example, does not tube feed your child at a specific time. So one of the things that we've done in order to better protect our child is he used to have a 504 plan, now has an IEP, and what we did in both plans is we included the IHP as a documented attachment to the 504 plan or to the IEP. That does not mean that the IHP is actually written into the 504 plan or into the IEP. That just means like at the end of any business document you can have attachments, or at the end of a letter you can have an official attachment. The same thing can be done with a 504 plan or an IEP, where you can have official attachment documented in those plans, and that attachment would be the IHP, which then makes the IHP have more legal recourse if it's not followed. So the law is on your side. If you need more support than just an IHP, there are specific federal laws that mandate how schools are supposed to care for disabled students. If a school receives federal funding, and that's anything from a public school receiving a majority of their funding from the government, or it can mean a preschool that just receives lunch funding. It could mean a preschool that receives $1 in funding from the federal government. They have to follow these laws. Now, if it's a private school, a parochial school, a private preschool, and they receive no federal funding, they do not have to follow these laws. So understand, if you're putting your child in a private school and you want a 504 plan, an IHP, an IEP, they are not required to follow the laws unless they're taking federal funding. So Section 504 and IDEA are the two laws that will protect your children who have a disability in EGID. What is ADA? ADA is the Americans with Disabilities Act, and this does apply to our children because the ADA does not specifically name all impairments covered under it. So even though it doesn't specifically name EGIDs, it does provide for support for our children because our children do fit the definition of having a disability because they have impaired ability to be fed. What is Section 504? Many EGID kids will qualify under this law, and this really lays the law down to schools as how they are to accommodate their students that are disabled. For example, you've probably seen my son riding around here in a little green wheelchair, running people over very fast. Well, when he's in school, one of the things that everybody pretty much knows, they have to have wheelchair ramps. And when we go on field trips, the field trips have to accommodate him in his wheelchair. Well, this same law, ADA, also applies to him when he needs accommodations for his EGID. So when we go on a field trip and it goes to a restaurant, what's going to happen? Is that really an appropriate thing? How are they going to accommodate my child? But he does have to be accommodated because he is covered under ADA. So does that make sense? Also, it would cover him if he needs multiple bathroom breaks. Also, if he needs to eat, he needs to be able to eat snacks constantly throughout the day. So he's allowed to do that at school, even though it is against school policy for him to be able to do that. It can cover what to eat, where to eat, special food situations such as parties. We had a great teacher this year who made sure every item at every party was one of his 16 safe foods. He can eat Skittles, and she always had Skittles out on her desk, which is a really great thing that we didn't ask for, but she just did. Tube feedings, where are they going to be done? One of the things we were adamant about is that our son would not leave the classroom to be tube fed. He was not going to miss his education to go to the nurse's office where there are germs and do his tube feedings. It's not a gross thing, it's how he eats. So he gets all of his tube care in the classroom unless it is absolutely necessary in an emergency. So the nurse comes to him, and the school has 5 minutes to send the nurse to him to the classroom when there's a problem with his feeding tube. Field trips, sick days, I hear from a lot of people who have trouble with being turned over to the truancy officer because their kids miss too much school. That can be included in the 504 plan. If your school says that it can't, it can. And they are not correct about that. Now, IDEA. This is the law that's also specifically written for schools, and this is where the idea of FAPE came from. It requires the public school system to develop appropriate individualized education plans for students with disabilities. These specific special education plans and related services are outlined for the student for their individual needs. If a child has an academic, social, or behavioral need due to their medical condition, and it has to be one of those three, it has to be an academic, social, or behavioral need, then an IEP plan would be appropriate. It really spells out specifically how your child is going to learn and be managed at school. Accommodations can be included in this plan, but unlike the 504 plan, which is strictly the accommodations, the IEP includes goals for the behavioral needs, the social needs, and the academic needs. For example, one of the things that my son in particular, we switched from a 504 plan to an IEP because he was having a lot of trouble. He was missing school, and it was hurting him socially, and I'm talking like 60-plus days a year of school. And even though his grades were really high, he was falling behind socially. So he was put under an IEP so we could address those things, such as the school actively teaching him to self-advocate, the school actively putting together social groups for him. And that sort of thing can come under an IEP because he had that social need. There are many reasons why children with EGIDs would need a 504 plan or an IEP. Many families pursue these plans, others do not, and you just basically have to look at your own need and see if the school is working with you and if you have a plan in place that's going to work for you. I think in our situation, yes, we did need this plan. We needed it in place because teachers change, administration changes, and kids transition from schools to school, and you want that consistency throughout their life so they're getting the accommodations that they need as they grow. And also so you have some control as a parent over how their disease is managed at school. How do you get started? First things first, you need to make contact with the school. You need to do this in writing. Every bit of contact that you have with the school when you're putting education plans in place really has to be in writing. Otherwise, there is no documentation of what you did. And even though you may have a great relationship with this school, with the principal, with the teachers, any communication you have really has to be documented. APFED has a template letter on the website that you can use. It's under the school advocacy section, under the resources, drop-down resources tab. And you can find that and use that template letter to request an evaluation for an IEP or request a meeting for a 504 plan. Now, if you feel as though your child's medical condition is impacting them in more than just their physical health, one of the things you can do is you can request a psychoeducational evaluation. And we did this because we weren't really sure exactly how our son's health was impacting his education. We found it incredibly helpful. Oftentimes, schools will even pay for it in our situation. That's one of the things we worked with the school to do. Insurance will cover it sometimes, and we got a lot of feedback in that evaluation on how our son's disease is affecting him educationally. Next thing, gather the records that you need. Talk to your physician. There is, on our website again, there's a letter that you can give to your provider that explains what these plans are and explains why it's important to have their support. And communicate with your physician as to what the school needs from them, because the school may want to have in writing from the physician what accommodations he thinks is necessary. So if you're communicating with your physician and say, look, my kid is having this problem in school, would you mind writing this letter and stating that he needs these accommodations? I've found that our physicians have been very helpful in providing that documentation to schools. However, one of the things I hear so often from people who contact APFED is, the school wants access to my doctor. Should I sign this release? Absolutely not is my answer. And people may disagree with me on this, but if you give them the ability to talk to one another and you have a school teacher who may never have heard of any eosinophilic disorder talking to the doctor and you're not in the middle and knowing what's being said, you as the parent have given control over, and they may not understand what the doctor's saying, and the doctor may think that they do understand. So you really need to be the person who is navigating that and advocating for your child's best interest. And then also go to APFED's website and explore the resources that we have there for school advocacy. But the school says, my child doesn't need an evaluation. They don't offer special needs classes. My child does fine in school. We heard that a lot. My child isn't sick enough to need anything. My child is faking the illness. My child will be fine with just an IHP, which we already talked about is not legally binding and doesn't provide accommodations. What the school says doesn't change your child's diagnosis. It doesn't change the definition, the legal definition of a disability. It doesn't change their legal obligation, and it doesn't change the federal law. It doesn't change that your child has a right to this. Keep your focus on the child and what your child's rights are. So what do you do to prevent conflict? Get everything in writing. If you have everything in writing and they know that you're communicating with them via email, they're going to be very careful about what they're saying to you. They're going to be careful about what they're writing. And also you have records. Check your emotions at the door. Focus on the facts with them. Enter your meetings with the school as if it's a business meeting. Don't go in there and say, I was up all night and I'm just so stressed and my child's so sick all the time. That may not be what they're seeing at school. Your child may be sucking it up at school and acting like they're doing great and then fall apart when they're home. So say that. Say what the facts are. On Tuesday, my child came home and they were in tears and they couldn't sleep all night, and then they went to school anyway, and now they're vomiting, and, tell them the facts of what happened. Just like she was saying earlier, tell the ER doctors the facts. Same thing with the school. Try and check your emotions and stick with those facts. And remain child-focused. When you're coming up with these plans, it's not all about what we want as a parent. You also have to really consider what your child wants. My son is in his IEP meetings, and the first thing we do is we ask him, what do you want? And my son was on, due to other health problems, he was on homebound school through our school system for 2.5 years. Last summer, we went into his IEP meeting, and my son sat there at the beginning of the meeting, and we said, what do you want? What do you want us to discuss? And he said, I want to go to school. And the whole table looked at each other, and we have a great IEP team, and everybody looked at each other and thought, oh no, are you kidding? How are we going to do this? But we had to keep the focus on him and what he wanted. So we didn't ask the doctor's permission in this situation. We said, you know what, let's do it. Let's give it a try. This is what he wants. This is for his emotional health. We've got to try it. And we were able to figure out a plan where he could at least go part-time to school. So keep your focus on your child and also discuss what your child really wants and what his or her needs are. And then the one I don't have on here is be patient and understanding of the school. Schools don't know what these diseases are in most cases. They don't know how to pronounce them. It could take a year or two for them to understand. Send them our resources. Talk to me if you want to, and I can help you navigate through how to word things with the school to make it a positive interaction. And know that even if you're in the worst of situations, you can turn things around with educating them. Now, when you've hit a wall, what do you do? I know a lot of people have already looked at the school resources that APFED has on the website. Use those resources. Send the school those resources. They're very well developed by a school advocate that specializes in EGIDs. If you have a 504 plan, you can contact the Office of Civil Rights. We've actually used this ourselves with a school situation just to get advice. You don't have to file an official complaint, but you can contact them and get advice from them. You can also contact, what's not on here is the State Department of Education, and talk to them. We've had to do that before and get advice from them on how to handle situations. Again, we didn't file official complaints, but just to find out what are the laws in my state. Can you help me understand this a little better? And if you present it in a way of, I want to understand what I can do to help my child, you might get some help from them and some good advice from them. The Parent Center Network and the National Disability Rights Network, these are organizations I've also personally used. And every state, these are federally mandated programs for people with disabilities, and they have them in each state. One of the programs, you call your state program and you can talk to an advocate. And that advocate will help you talk through your situation and how you might be able to better advocate for your child. And they generally do know the laws in your state. The other one is a program where you could talk and get legal advice for free from an attorney. And I used this also and was able to call and get advice about how to handle a school situation, got excellent advice, and it really helped us turn our school situation around to a positive experience. So to end, going to school with EGID is possible. It can be frustrating, it can be daunting, it can be emotionally exhausting for you as a parent, but keep in mind that your child is number one, and if you keep your focus on your child, keep the school's focus on the child, you can be successful in doing this. Rights Law is a great website that you can use for research. They also offer books that are fantastic for research. With the right resources, you and your child can have a great school year. And I'll be around afterwards if there's any individual questions. I'm happy to answer them, and you can also contact me through APFED if you have any follow-up questions. Thank you.